My name is Haley Yost, and today we will review baseball stitch for educational use in obstetric and gynecologic surgery. The purpose of this video is to demonstrate baseball suturing, which is a technique commonly used in obstetric and gynecologic surgeries. The baseball stitch is used in myomectomies and classical cesarean sections. It is used to approximate the uterus, and it inverts the serosal edge to attempt to decrease scarring. It also compresses the tissue, which will help with tissue oozing and bleeding. For this technique in the video, we are using an O-PDS Plus on a CT needle. However, in practice, for myomectomies, you use an absorbable unidirectional barb suture, and in classical cesarean sections, you use either a 2O or 3O vicryl or monocryl suture. Let's start by reviewing this diagram. This diagram is used throughout the video as an animation for each step. It is important to note for this technique that this is a deep to superficial throw. To represent the deep stitch, we used a dashed line. To represent the stitch that lays on top of the tissue, creating the baseball appearance, we used a solid line. In this picture, we can see a completed baseball stitch using this technique. We will work to achieve this throughout this video. First, we will start with an anchoring stitch at the apex of the incision. The anchoring suture is done by throwing a stitch deep to the tissue and pulling it through superficially without going through the top layer of tissue. Next, you will tie the first knot of the baseball suture. You will do this by wrapping your suture around your needle driver twice, grabbing the tail and pulling it through. Cinching the suture down creates your first knot. Next, moving in the opposite direction that you just did, you will wrap your suture around the needle driver one time, grab the tail, and pull it through, creating your second knot. For the third knot, you will do the same technique, however, you will go in the opposite direction that you did from your second knot. For the first throw, I find it helpful to backhand the suture. This will ensure that your hands are moving in a way that is helpful for your body and will allow the suture material to go through smoothly. Revisiting the diagram, we can see that we have completed step 1 and we're moving on to step 2, which you can see is followed by a solid line. This indicates that the suture material will be lying on top of the tissue, and now we can move on to step 3. In a similar fashion, we will load the needle, but this way we will do it forehand and we will move deep to superficial, this time still coming through that top layer. Revisiting the diagram, we can see that we're ready for the next step, and we will continue the same technique that we did prior. We will backhand the needle and move through the tissue in a deep to superficial fashion, going through the top layer of skin. We can see that this technique continues throughout the rest of the video, alternating between backhanding and forehanding the needle. Of note, you can forehand the needle on one side and then backhand the suture when the needle direction needs to go the other way, or you can rotate your body and do it forehand on both sides. After sufficiently closing the incision, we will tie a knot. To tie this knot, we will throw our last suture in a deep to superficial fashion, as shown in the diagram. We will use the suture material to wrap around the needle driver twice. We will grab the loop and cinch it tight to create your first knot. Next, you will wrap the suture material around the needle driver in the opposite direction, grab your loop, pull it through, and cinch down to create your second knot. We will repeat this process for the third knot, moving in the opposite direction as we did for the second. This will ensure that we create a square knot, which is more secure. Thanks for watching this video. We hope with this, you will be able to identify the baseball suture, the indications, and be able to practice this technique following an animation.